The October 27, 2009 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Miss Andrews, Mr. Cruz, Mr. Hanna, Mr. Lightfoot, Mr. Quattro, Mr. Yolovich, Chairman Daniele.
Here. Is there anyone signed up to speak in the public forum?
There is one public forum speaker. Would Vincent Shelton please come forward and address the committee?
Whatever you need.
Good evening. My name is Vincent Shelton, and I'm the president of Rochester's Poor People Coalition and also a board member at the House of Mercy. The issue I wish to address, I presented before the full ledge, and now I would like to present it in this forum. The Human Service Department at 691 St. Paul Street was not designed to accommodate the number of people it currently services. Due to the high number of people coming for assistance and appointments, the extra measure in security screening, and the periodic closing of the drop-off desk, and the drop-off desk is when people just come in to drop off documents. They can go to one particular desk, but there seems to be a problem with keeping that open on a consistent basis. With the cold weather about to set upon us, many people who come for services, because of these procedures that are in place and whatnot, it takes them quite a bit of time to gain entrance to the waiting room. So therefore, the line is extended from the front door all the way out to the outside to the parking lot. And being that it's about to get cold, we have concerns for the mothers and children who would have to be standing out in this type of weather. So we are suggesting that an enclosed canopy be erected from the front door to the parking lot, which would provide the people protection until they got inside. We also ask that opening every window in the waiting room. There are numerous windows in the waiting room that are not occupied. I think by opening all the windows and staffing them, it would expedite people being processed and being able to get in and out in a timely manner. And it could be beneficial to the staff as well because they won't be overwhelmed at any one window. There was always basically someone at the drop-off desk, but recently, as I pointed out, it hasn't been being staffed on a regular basis. I'm suggesting that if someone at that desk goes for lunch or takes a break, that there be someone to fill in for them. By having someone there, it decreases the number of people waiting in line to be processed and having to go into the waiting room and wait an hour or two just to drop off a document. The last thing that I would like to suggest, and I don't know if finances would allow it, is possibly renting space across from the center at 691 St. Paul, that big factory building where they now have a charter school, renting space there and possibly administering some services from there. I thank you for your time and your attention to this matter.
Thank you. Is there anyone present who is not signed up to speak who would like to address this committee at this time? There's seeing none. We now have a presentation from Hillary Clark, who is the Regional Director of Advocacy for American Cancer Society.
Good evening. I have folders that we can get to each of you. I appreciate the opportunity to speak tonight. on the exciting topic of calorie posting. My name is Hillary Clark. I'm with the American Cancer Society, and I'm here today with Mark Cronin and Eileen Wolf, also from the American Cancer Society, supporting calorie posting in chain restaurants at the local level, which I'll talk about more in a minute. The effort here today is part of the Cancer Society is part of a larger statewide coalition called the New York State Healthy Eating and Physical Activity Alliance, or NYSHEPA. NYSHEPA is a coalition of over 100 organizations that's been working on calorie posting legislation across the state. The American Cancer Society supports this effort because we believe that calorie posting allows consumers to make wiser choices when dining out. The legislation that we support would require that calorie content be posted at the point of purchase on menus, menu boards, and the drive-through menu. And typically, this type of legislation applies to chain restaurants with 15 or more locations anywhere in the country. That's the way other counties have phrased their legislation. This is a priority for us because of the strong link between obesity and many forms of cancer, including colon, breast, and prostate cancer. In fact, the cancer risk related to obesity is second only to the risk connected with tobacco. Up to 20% of cancer deaths among women and 14% among men have found to be linked to obesity. Calorie posting in Monroe County would not be groundbreaking. Similar laws have already passed across the country in California, Portland, Seattle, and Philadelphia. And in our state, laws are on the books in New York City and in the counties of Suffolk, Ulster, Westchester, Albany, and Nassau. There are also a couple other counties that are looking at this, including Erie County, where I presented to their health committee just a few weeks ago. In New York City, which has had legislation on the books for the longest, their law went into effect in the summer of 2008. A survey found that fast food customers who saw calorie information displayed purchased 52 fewer calories than those who didn't see the information. That could prevent almost 3 pounds of weight gain yearly for the average fast food customer. Other surveys also show positive results, and just yesterday, a new study, preliminary results from a new study was released by the New York City Department of Health. And their preliminary findings showed that people bought food with fewer calories at 9 of the 13 fast food and coffee chains included in a study on the effects of the law. The researchers in New York City surveyed more than 10,000 customers at 275 locations in early 2007 and another 12,000 this year. And they found statistically significant decreases at 4 chains and said diners bought food containing 106 fewer calories on average. The city is looking to release all of their findings probably in a few weeks or so, but they did present their preliminary findings at a conference yesterday. And there's an article in your folders that talk to that. In addition to the impact on consumers, so consumers are purchasing fewer calories, which over the course of a year will translate into pounds lost. We're also seeing changes in the practices of restaurants, and mainly that's out of California. We looked at before and after calorie labeling requirements went into effect and found significant decreases in calories in a number of items. So the way that the restaurants has adapted was by changing the recipes for some of their existing offerings, by making them a little bit more nutritious, and also by adding additional menu items that were in fact healthier. So we saw both restaurant and consumer changes due to the law. The reason why we focus on chain restaurants is simple. U.S. adolescents visit a fast food outlet twice per week on average, and the extra calories pack on an extra 6 pounds per child per year. Moreover, low-income people who are more likely to be overweight eat fast food disproportionately. Many fast food restaurants make information available, but if patrons can't see that information when they place their order, they don't use it. So, for example, I know last time I went to a McDonald's, they gave me my food on a tray, and there was a nice tray liner that contained all of the calorie information for everything that they offered, but I had already purchased my food, so it was a bit too late to influence my decision. They have that information readily available. We're just asking them to make it available to the consumers at the point of purchase or the point that you're making your decision. We know that this policy change is not costly for chain restaurants. Menu boards and menus are routinely updated to include seasonal items, new pricing, etc. Most menu boards have slats that can be slid out and replaced. And for many chain restaurants, restaurant headquarters, not the local franchise owners, incur any costs. The phase-in period for calorie labeling would allow restaurants to add calories the next time they would be redesigning or reprinting their menus. So you'll see in your folders that we've given you the Westchester County law as a sample, and their law takes effect 6 months after passage, and we do that because most fast food restaurants change their menus an average of twice a year. They change their menu boards more often than that. So for all of these reasons, we're urging Monroe County to join some of the downstate counties that have already done this and to begin to offer this type of consumer information to consumers here in Monroe County as well. I know this is probably the first time many of you are hearing about this, so I'd be happy to answer any questions that you might have. No one. Okay. In the folders that I provided, there is my business card. So I would, if you think of a question or you would like in more information, I'd urge you to feel free to reach out.
Thank you, Ms. Clark.
Okay.
The next item on the agenda is the approval of the minutes. You have the September 22nd, 2009 minutes before you, and they will stand approved unless the clerk is notified of any changes by the end of day today. The next item on the agenda is new business. Madam Clerk.
Referral 325, acceptance of a grant from the New York State.
Moved by Legislator Jolovic, seconded by Legislator Quattro. Is there any discussion on this? There seeing none, all those in favor, please signify by saying aye. All opposed, motion carries.
Referral 326, acceptance of a grant.
Moved by Legislator Quattro, seconded by Legislator Hanna. And before we get into discussion on this issue, at the last Human Services Committee meeting, I had asked the Director of Public Health, Dr. Doniger, to give us an update on the H1N1 virus situation, which is pertinent to some degree to this referral. Since we're talking about vaccination, I guess. And Dr. Doniger, if you wouldn't mind.
I guess I just wasn't in close enough. The H1N1 pandemic began in this country in the spring. Obviously, we experienced it here in Monroe County, but then there was a quiet period during the summer. The disease returned in most parts of the country right around the time that school started. Somewhat surprisingly, we didn't see it actually too much in September, and it's only really in the last week or two that we have begun to see large numbers of cases that are being reported to us. We have been tracking the school absenteeism for influenza-like illness, and many schools are reporting increased numbers of children absent. The numbers of patients that are reported that have influenza-like illness that are seen in the emergency rooms is on its way up. It has not reached proportions that it's really compromising the ability of the emergency rooms to do their work. But obviously that is a great concern. So it's here, and we are involved in a variety of different efforts to try to minimize the impact on the population. Obviously, we want to reduce the number of cases. We want to reduce the number of deaths and the number of hospitalizations. And there are some interventions that we have that we know will be effective. Some of the things that we're involved in, obviously, we're very involved in communications, trying to help people understand the difference between seasonal influenza and H1N1 or swine flu, and also who is most at risk and who needs to watch out for early signs and symptoms of influenza, and what they need to do to keep themselves healthy. On the one hand, we want people to seek medical care. On the other hand, we do have some concerns that with the large number of people that are ill, if everybody goes to the emergency room or everybody seeks care in a physician's office, the system will be overwhelmed. We've also been involved in managing vaccine distribution. The H1N1 vaccine is different in a way than the other flu vaccines that we've had, in that this one has been all bought up by the federal government and is being distributed through the public health system. Normally, vaccines are sold and then distributed through the vaccine manufacturers and the wholesalers and providers purchase them. They typically put their orders in the beginning of the year, and then they get them in the fall. And historically, we've had a lot of problems with getting the vaccine to the right people and to the doctors that need it the most, the ones that take care of the most high-risk patients. And there's been a lot of problems with delays in the delivery. So we have this kind of interesting experiment going on right now where we have the government trying to distribute vaccine in a way that we hope will be more efficient than the system that we've had in the past. And I guess we'll see at the end of the year whether this has turned out to be a good method or not. But those of you that are following this obviously have are well aware that there is a reduction in the amount of vaccine that has been manufactured. So there's less that is being distributed to all of the doctors' offices in the community, and there's less that's available to the county health departments to do mass clinics. We have over 300 medical providers that have signed up to receive vaccine, and many of them have already received shipments and have started to administer the vaccine in their offices. And that we were very pleased to see the large number of providers that signed up to participate in this. We have ordered large quantities of vaccine, but up until this point we've only received very, very small amounts of the vaccine, and we would like to begin to administer vaccine in mass clinics, much like is done with seasonal flu, in some of the big venues in the community, such as the Dome Arena or in the War Memorial. But at this point, we don't have enough vaccine on hand to start that. So we are waiting to get clarification of exactly when we will receive vaccine in significant quantities. The other thing that I mentioned that we're involved in is managing the potential surge in the medical care system. You are surely aware that on any given day, it's likely that one or more hospitals in the community are on diversion or code red, and they direct ambulances to go to a different hospital because their emergency room is so busy. And this is before we start to layer over on top of that the pressure that could be on the emergency rooms for H1N1. The emergency rooms are very busy now, but they do seem to be holding their own. We do have plans in place to set up alternate care sites that would be kind of like emergency rooms, but would specifically be providing care for those that have signs and symptoms of influenza. And you probably are aware that over the weekend, the president declared a national emergency that allows the hospitals to change the way they operate. Traditionally, when you go to a hospital emergency room, there are certain things that you would expect to see there. For instance, a surgeon is on call, or an anesthesiologist is available, within a few minutes. So with the emergency, the declaration of a national emergency, the hospital emergency rooms could be operated in other parts of hospitals, for instance, or in outpatient settings, so that they could see the surge of patients. Historically, when we have pandemics like this, it comes in waves. They last 6 to 8 weeks. I think we're about 2 weeks into our wave. I think that we probably are going to continue to be seeing a lot of activity through the end of the year. Then it should quiet down a little bit. That's when seasonal flu starts. We may see ordinary flu, or maybe this will turn out to be the flu that's here this year, the H1N1. And it's possible that we'll see another wave or another surge sometime in the late winter or early spring. So we're very busy in the health department. The medical care providers in the community are also very involved in this, and I'd be happy to continue to keep you updated.
Thank you for that. A couple of real quick questions. When you're talking about the vaccine, I mean, obviously, what I'm hearing from constituents and from doctors is, they've placed these orders, and, the numbers on a national level, the government has ordered, 260 some odd million units, which, ordering is one thing, actually having the units is another, which is what I understand the problem is. How many units do you think we need in Monroe County versus how many are you expecting to actually get? Need meaning there's a demand for, not necessarily required for.
I don't know how to answer that exactly, but the Centers for Disease Control has identified sort of 3 different tiers in the population in terms of risk for complications, serious complications for H1N1. And Tier 1, which includes groups like pregnant women, medical care workers, EMTs, young children, and older children that have medical risk factors for complications. That group includes about 400,000 people in Monroe County. So historically, when we've given flu vaccine, it's been taken up by 50 to 60% of the population. So I think it would probably be good to have somewhere between 200 and 250,000 doses of the vaccine coming into the community. I don't think we're going to get there, though. I don't think that we're going to have that. I think that the final numbers will probably fall short of that. But we don't have any clear prediction of the total numbers from the Centers for Disease Control. What they've said, though, is that the total number is going to be less than what they had expected, and that there's going to be a delay in the shipment of it. So we'll have to see. The point is we need to have it here now because we're starting to see the disease. And if it arrives in January and February and we don't have any disease at that point, I think we'll still be interested in administering it to people to prevent them from having the complications during the next wave if it occurs in the spring. But it would really be great if it would arrive quickly and we could get it out to the doctor's offices and then also run some of those mass clinics.
And obviously, as you said, informing the community and keeping as many people informed is probably the most important job that you have. What is the best way for the community to get information? I mean, is there a hotline? Is there a website? Or should they go to the CDC website, where they can get some kind of reliable information? I would imagine that part of the reason there are more doctor visits and that the hospitals are getting flooded aren't necessarily that, I'm sure there are more cases of influenza, but I think people are getting a little paranoid, and where before they would stay at home for a few days and check things out, now they're calling their doctor, they're going to the hospital, and creating more of a demand where perhaps it doesn't exist. Is there, what would you deem as the most reliable source of information on this?
Well, there's a high degree of interest in this issue. It seems like there's a headline every other day about the vaccine supply or some new twist in the pandemic. I think that people are getting a good flow of information. There's some public health problems where we really can't get a word in edgewise. We can't seem to get to the public about a risk that is truly out there. So there seems to be a lot of news coverage, a lot of interest in this. I can't tell you how many conversations I've overheard and I've been dragged into about this issue in the last couple of weeks. But we do have on the county website a lot of information about influenza. A lot of the information that we have is really just borrowed from the state government and the CDC. And we also have links to some of the national websites as well. We also have a telephone hotline, the information line for the health department. The information line is used for whatever is the current public health problem when when we're administering some kind of vaccine or when we're running clinics. But obviously right now it has a lot of H1N1 information.
Thank you. Thank you for that explanation, and you're doing a phenomenal job. Keep it up and keep us posted.
Thank you.
And, Legislator Yolovic.
Please, Emily, do you have copies for our friends on the other side? This referral is at the request of the Rochester City School District, and it's pretty much self-explanatory.
Thank you. Thank you, Legislator Quattro, seconded. Legislator Andrews.
Thank you. Just a question on the amendment. So is this referral then solely with the Rochester City School District and not any other schools in the county through the chair?
That's what I understand.
Okay, thank you.
Just a clarification, there are some other districts that are participating, but the city school district requires an intermunicipal agreement. It's one of their specific requests, and it was inadvertently left out of the original referral. There are some other districts involved, but the city school district is by far the largest component of this agreement.
Thank you. Are there any other questions on the amendment? There being none on the amendment, all in favor signify by saying aye. Aye. All opposed? So amended. The original piece of legislation now amended. Is there any other discussion? Legislator Andrews.
And through you to the administration, can you tell me what schools were, in addition to the city school district, participated in the first year of this grant?
Through you, Mr. Chair, I can't actually tell you the names of all the schools, but there we went and I spoke to a meeting of the superintendents of schools about a year and a half ago and invited all of the school districts to participate in this project. The school districts that elected to participate were the Rochester City School District, Spencerport, Churchville, Chili, Pittsford, East Irondequoit, and Webster. We have a total of 24 schools, 12 in the city, 12 in the suburbs.
And through the chair, is your expectation that there will be additional schools in year 2 of the grant, or the schools remain the same?
For the first year of the grant was a planning year. The second year is the year that we are administering the vaccine. So this is the second year now. There's a possibility that there might be a third year. And if that's the case, I think that we will stick with the same schools.
Okay, thank you.
Are there any other questions? If not, all those in favor, please signify by saying aye. Aye. All opposed? Motion carries. Next item.
Referral 327, acceptance of a grant.
Moved
from the
by
New York-
Legislator Hannah, second by Legislator Yolovic. Any discussion on this referral? Legislator Andrews?
We were just talking some about H1N1, so we don't need to go through all of that again, but it looks like a large portion of this grant increase is due to funding for preparedness for that pandemic. Have we already selected vendors to do this work through this grant?
Through you, Mr. Chair, the vast number of vendors that we will use through this grant, or the largest number of dollars, are related to the services of companies that are sometimes called mass vaccinators. There are different agencies in the community that give immunizations, flu shots, in pharmacies, in grocery stores. It really developed into kind of an industry. We are contracting with 3 at this point. Two of them are on state contract, and the third we already have a contract with through the previous referral, that school demonstration grant. We also have a request for qualifications out to give the opportunity to other agencies and organizations in the community that would like to participate in giving immunizations with the funding that's available to us. There's obviously a substantial amount of funding that's available. So we will be deciding in the next few weeks, when the RFP comes back, what the constellation of providers will be. There are some other smaller contracts for some individuals that we've brought on. Those have been selected using the county procurement policies, RFQs for a number of different people that have come to help us out in the last few weeks. I would say that we're sort of scaling back the number of clinics that we probably will be doing, based on the fact that there's been a delay in the vaccine that's coming to us, and then a scaling down of the total number of vaccine doses that we will see. So we may not actually have. We may not spend as much money as we had thought when we had initially put the plan together for mass vaccination for this fall.
And through the chair, who are the 3 contractors that you mentioned?
The 2 that are on the state contract are Maxim and INC, and the third is one that we already have a contract with. That's the University of Rochester Medical Center School of Nursing.
And through the chair, you mentioned that we may not spend all the money just due to the circumstances. If that occurs, will we lose this revenue, or will there be a possibility to use it in future years?
Through the chair, I'm not sure that we know the answer to that. It may be that this will be available for use in the future for pandemic prevention, but I just don't know at this point.
And through the chair, will the providers that are selected come back to this body at all for approval, or is it possible, if they're not going to come back, that you could supply that information to this committee?
We will certainly be happy to supply you with the information. We obviously want to get going. We don't want to delay the execution of the contracts and the setting up of the mass clinics, but we certainly can let you know who has been selected.
Okay, that'd be great. Thank you.
Legislator Yolovic.
Through you, Mr. Chairman. Is Monroe County, or will Monroe County be consulting with other counties on any of these projects in any way?
Through the chair, yes. We actually have a consortium of the health departments in the 9-county area called the Finger Lakes Public Health Alliance, where we work on issues related to emergency preparedness planning.
Thank you.
Is there any other discussion? There being none, all those in favor, please signify by saying aye. Aye. All opposed? Item carries. Next item.
Referral 328, acceptance of a grant.
Moved by Legislator Yolovic, second by Legislator Quattro. Any discussion? Legislator Hanna.
Funding will be used for Department of Health staffing and services. It goes on to explain some of the services, but doesn't really explain the staffing. What staffing would be covered under this?
Through you, Mr. Chair, the grant will be used for funding for salary and benefits for 6 different positions that work in our STD control program, or STD and HIV control program.
Thank you. And through the chair, are these new positions? I see this is the 11th year the county's received the grant. So are these positions that are already in place, and this is just an ongoing continuation of those staffing positions?
Through the chair, yes, these are existing positions.
Thank you.
Any other discussion? There being none, all in favor, please signify by saying aye. All opposed? Item carries.
Referral 329, acceptance of a
Moved by
grant.
Legislator Quattro, seconded by Legislator Hannah. Any discussion? Legislator Yolovic.
Will tell me this, if not, maybe Commissioner Reed can. How many children do we expect to service in this foster care program?
We don't, through you, Mr. Chair, we don't provide services in the health department to all of the children in foster care in Monroe County. We provide services, medical services, to a subset that are with families, that are living with families, and that's about 400 to 500 children at any time.
Thank you.
Other discussion? Legislator Andrews.
How many total children, through the chair, are we currently serving through our foster care program?
Through you, Mr. Chair, do you mean in the pediatrics clinic?
Actually, overall, I guess I mean.
So you mean in addition the services that are provided by the Department of Human Services?
Yes, that's correct.
There are currently a little over 500 children who are in foster care in Monroe County.
Okay. Thank you. And through the chair, this morning I think we heard mention of this program at the groundbreaking for the Pediatric Center. Could you just get a further explanation in terms of what we expect this 3-year grant to do in addition to what we do now?
Through you, Mr. Chair, this grant has been provided to the county to demonstrate the effectiveness of some evidence-based interventions in the real world. And let me see if I can explain that a little bit. Sometimes there are interventions or programs that have been developed in academic settings, and they are shown to be effective, and they involve sort of experiments that don't really mimic real-world conditions. So one of the questions that is always asked is, it's great that we have these effective interventions or programs, but could they really be implemented in the real world? And so the Centers for Disease Control made available funding for counties, for institutions that wanted to demonstrate that some of the evidence-based interventions could be implemented in the real world. And so we've set up a system that allows us to really demonstrate in the real world how you provide services to all of the players in the foster care system. That's the biological parents, the foster parents, the children themselves, and all of the helpers that are involved, both in the Department of Human Services, in the Health Department, and in other institutions in our community. And we're hoping that through this we can demonstrate to the CDC that these programs can be implemented in the real world and they can be effective. And along the way, we believe that it will improve the outcomes for the families and the children that are in foster care in Monroe County.
Thank you.
Any other discussion? There being none, all those in favor, please signify by saying aye. All opposed, item carries.
Referral 330, amend resolution.
Moved by legislator Quattro, seconded by legislator Hannah. Any discussion? Legislator Hannah.
How many families will be served in this project?
Mr. Chairman, through you, with this amendment, this program can serve up to 200 individuals in the non-compliant portion of the grant and 70 to 75 individuals in the under-engaged portion of this grant.
Okay, thank you. And through the chair, this is the third year the county's received the grant. Do you have any numbers for success in the previous 2 years?
Mr. Chairman, the answer is yes. I'm just digging to it. Well, through you, Mr. Chairman, I don't have percentages calculated. We do have a variety of performance measures. Instead of me going through this list, would it be acceptable to provide you, Mr. Chairman, a copy of these measures, both the 2008 goal actual versus 2009 goals?
That would be fine.
Yeah, that would be fine.
Thank you, Mr. Chairman.
Thank you.
Any other discussion? There being none, all those in favor, please signify by saying aye. Aye. All opposed? Item carries.
Referral 331, acceptance of a grant from the New York.
Moved by legislator Yolovich, seconded by legislator Quattro. Legislator Andrews?
This referral and the next referral seem to both provide employer subsidies for hiring employees on TANF, and both in the healthcare industry and transitional jobs programs. Can you explain how employers will be chosen to be a part of this or to receive this subsidy?
Mr. Chairman, through you, there is not an application process to choose employers. What the Department of Human Service does is reach out to, one, existing employers that we have a relationship with through our own staff or contracted job developers, and two, perform outreach to new employers to try to build those relationships, either through our own staff or contracted staff.
And through the chair, can you either say now or provide a list of the existing employers that you are anticipating providing this subsidy to, and then the new employers that you are currently outreaching to?
Mr. Chairman, through you, we do have almost all the jobs lined up with employers, and therefore, yes, we can produce such a list for this committee.
And through the chair, how does this work? I'm just curious here. I don't think I've seen a referral like this quite before. Are people only employed for 28 hours with these employers, and is it for a year or 2 years or 6 months, or is it till the money runs out? Or can you just talk a little bit about how the program's going to work?
Mr. Chairman, through you, this program works a little different from our TEAP program, which I've discussed at previous meetings. This type of job subsidy, it's a little different between the transitional jobs and healthcare jobs, but in essence, New York State requires for the transitional jobs that the temporary assistance client be engaged in the work activity 35 hours per week. Of the 35 hours, 28 will be work scheduled at the employer, and the other 7 hours is structured training. That could be structured training at the employer or structured training through one of the state's other contracted employment services or county services, such as a GED program. The subsidy is a full salary subsidy. Usually it's an hourly rate. It does not include fringe benefits, but it represents 100% of the wages paid to the employee. Because of this arrangement, this transitional job will actually result in a temporary assistance case closing, unlike the TEAP contracts. These transitional jobs agreements will last for a period of 6 months if the employee, our former client, remains with that employer, with the expectation, of course, that full-time employment will continue beyond that 6-month period.
And through the chair, how many clients are going to be served by this program?
Mr. Chairman, through you, we anticipate creating 150 transitional jobs through this grant.
And through the chair, do you know the average hourly wage that the jobs pay?
Mr. Chairman, I do. The state award requires a minimum hourly rate of $8. I believe on average we exceed that, probably by a little bit, but I'll have to check that fact for you.
Okay. Thank you.
Legislator Hannah.
Now, if I understand this correctly, the 28 hours of employment and the 7 hours of weekly training are all reimbursed to the employer. Is that correct?
Mr. Chairman, that's correct.
Thank you. And through the chair, the program runs for 6 months. Is there any contractual obligation by the employer to continue with the employment? Or you said the expectation that they will continue with the employment, but is there any contractual obligation to continue with the employment?
Mr. Chairman, the contract we have with the employers is modeled after the TEAP contract. Oddly enough, we cannot require continued employment. We basically cannot require the employment for personal services, but the expectation is in this MOU that employment will continue beyond the 6 months.
Thank you. Are there? This is the first time we've done this. Is this? We've never done anything like this before. Is that correct? Through you, Mr. Chairman.
Mr. Chairman, this specific type of subsidy program has not been done, to my knowledge, in Monroe County. The closest we come to this program is our TEAP contracts, which reimburses an employer up to the higher of 50% of the client's wages or the client's temporary assistance grant. And we generally write those TEAP contracts ranging from anywhere from 1 month to 6 months.
Okay, and through you, Mr. Chairman, you anticipate that many of the employers that you'll be using this through this program are also the employers that you've used in the past through the TEAP program?
Mr. Chairman, yes, many of the employers are existing employers that we have relationships with.
Thank you.
Legislator Cruz.
Mr. Chairman, through you, there is no fast track to re-engage a client back into the temporary assistance program. Their household needs would have to be reevaluated at that time.
So theoretically, if somebody finishes, they start January 1st and finish June 30th, on July 1st they will be without a job or public assistance. And how long will it take for them in a normal case to get back on public assistance?
Mr. Chairman, through you, in theory, that is correct. Someone could be engaged January 1st through June 30th and be out of a job. I'm quite confident that the Department of Human Services will know in advance whether that job will be continuing. Applications are processed by our intake staff. On average, it's a little more than 30 days. Benefits are, once a case is established, benefits are provided to the household as of the application date.
Okay. So there's no, I mean, for that 30-day period where they're not receiving any assistance, any income, any kind of rental assistance, do you foresee a disruption in that?
Mr. Chairman, I don't think I can really answer that question in advance of the event actually happening. I will say that
Then speculate for me, please.
a household may or may not have benefits available. What I mean by that is TANF families who obtain full-time employment receive transitional benefits, which include Medicaid and food stamps.
Through you, Mr. Chair. Well, that's fine and dandy, but you know, there's a landlord probably that's waiting for his rental check in July. How are you going to work with this family in the event that they don't have that income for that month, waiting for public assistance?
Mr. Chairman, through you, even in this tough economy, the Department of Human Services has maintained a phenomenal job placement rate per month. We continue to work with many of the clients or applicants that we place into jobs. We have a contracted agency, Career Start, and some of our own staff who will provide job coaching, employment counseling, including late-night phone conversations with the client when they get nervous about a situation happening at work. We actually will also agree to meet with the employer with or without the client present to discuss the situations. We have a whole host of activities that we provide related to job coaching. We are fully aware that getting a job is only half the battle. The other half is keeping a job. Transitional jobs like this or our TEEP contracts have a pretty good success rate when it comes to retention. Transitional jobs that provide a full wage subsidy nationally have about a 70 to 75% retention rate. It is pretty good. For those clients who are unable to keep their job, and that usually is the case, Mr. Chairman, it's the clients, the employees who are unable to keep their job. It is not that the employer chooses to cease the employment at the end of the contract. If that were the case, we would not have a relationship with that employer. So we do pretty well. We have many clients that transition to employment. That is the goal for welfare, Mr. Chairman, is self-sufficiency. For those clients who, through some unfortunate event in the future, need to come back to temporary assistance, we will process their application with all the expediency that we process all of our applications. And, Mr. Chairman, in today's circumstances, that's averaging a little more than 30 days with benefits available retroactive back to the application date.
I understand and do appreciate the work that through you, Mr. Chair, the work that you folks do there. It is a challenge to do that. I guess my concern is if, you know, the way that, and you mentioned today's economy, you know, there is a shortage of jobs, there's a shortage of job opportunities. And you got folks that are willing to go out in this kind of transitional program, and that's a good positive thing, but I'm sort of concerned that, you know, that there is that kind of lag period between the time they finish the project, they finish this work, and if they can't keep them there, they're going to be out of a job and within 30. And we know that, yes, you're right, on an average of 30 days, they do get public assistance. That's a lot of times not the stories that I hear where people are have to wait much longer. And I guess I'm just concerned on the transitional. Why can't you just keep these cases open in anticipation of A, that they do get a job and then close it at the end of the 6-month period so that they have an easier way of transitioning back so that there is no disruption of Medicaid, a disruption of child care, and those kinds of issues?
Mr. Chairman, through you, that is the arrangement we have under our TEEP contracts.
But you said it does, through you, Mr. Chairman, sorry to interrupt you. You said through this project is not part of that arrangement. You closed the cases.
Mr. Chairman, through you, the legislator is correct. Cases remain open under TEEP, but it is not the arrangement under this award. This award is given to us through New York State via the federal government, and we do have to comply with their rules. As I mentioned, there should be no disruption in Medicaid, as families who transition to employment can receive up to 12 months of Medicaid benefits, and it's likely they will continue to reach food stamp benefits as well, and child care.
Okay, so I just want to make that through you, Mr. Chair. I want to be very clear about this. You're telling me that the thing about having to close these cases is not a local decision; it's a state or federal decision. That's a mandate by which they're telling the county that once a person does become employed through this project, that we have to close our cases. I just want to make sure that I'm clear with that.
Mr. Chairman, through you, Legislator Cruz, you are clear on that.
Okay.
It is because of the style of this program that a case closing is the result.
Okay. And my last question, real quick. Do you have nonprofits nonprofit agencies that as employers in your list?
Mr. Chairman, through you, I think the answer is yes, but I can't answer that definitively without seeing the list in front of me.
All right. Would you provide that information?
Mr. Chairman, I know the answer is yes. I will provide the list of employers, but I know the answer is yes because Unity Health is one of our employers. They are nonprofit.
And again, through you, Mr. Chair, real quick, the nonprofits are also being notified about this project, so they can also come in potentially as employers?
Mr. Chairman, through you, to be clear, it's not like we had a mass publication that this program was available. We have employers that we have existing relationship with. We reached out to new employers to try to build relationships. If there's an employer out there who would like to work with the department, I would be most anxious to hear from them. We will turn away no one.
Well, and just as a quick comment, I think that if you've got folks who, because face it, as you said before, and it's an interesting point, that it's just not about getting somebody a job. It's all the support you provide that person while they're either looking for a job or while they're in a job. And you've got ready and available resources in the community with a number of organizations that we have here in town who provide a lot of those support services. They provide daycare, they provide career counseling, they provide GED services. And it would seem to me that instead of having to go and find those services and have to contract out for them, that you have that in a partnership with some of the large nonprofits who can provide that and who provide that on a daily basis to their clients as well. And so I just see a partnership there and something that I think we should exploit. That's my only comment. Thank you, Mr. Chairman.
Thank you. Any other discussion? There being none, all in favor, please signify by saying aye. All opposed? Item carries.
Referral 332.
Moved by Legislator Hanna, seconded by Legislator Yolovic. Any discussion? Legislator Andrews.
Thank you, Mr. Chairman. Through you to the administration, is this program modeled in the same way as the previous referrals program?
Mr. Chairman, through you, both the healthcare jobs and transitional jobs do follow pretty much the same model. Yes, ma'am.
And through the chair, you said pretty much the same model. I just want to make sure that does this referral as well contain the 7 hours of weekly training in addition to the 28 hours of work for the clients?
Mr. Chairman, through you, the healthcare jobs grant does not have the 7-hour mandate within it. The other difference I would probably highlight is the slightly higher hourly wage rate. This award requires a $9 rate.
Through the chair, then, so this award is 28 hours of work per week at a rate at least of $9 an hour, but without any training to assist the client. Is that correct?
Mr. Chairman, through you, I do not believe this grant specifically highlights 28 hours. We will be engaging our clients up to 35 hours under this grant.
And through the chair, how many jobs are created through this referral, this grant?
Mr. Chairman, approximately 100.
And through the chair, could I request a list of the employers who will be participating under this grant as well?
Mr. Chairman, that will not be a problem.
Thank you. Sorry, I have one final question. Through the chair, is it also a requirement from either the state or federal government that the TANF case be closed as the client starts this 6-month employment period?
Mr. Chairman, that is correct. I do feel the need to be clear. It's not a requirement of the specific award to close these cases, rather more the requirements of the existing underlying temporary assistance regulations that result in a case closing.
Sorry, through the chair, could you just explain the difference, please? And actually, my real question is then, is it a local, please explain the difference as well as, is it a local decision then, or is it still a decision from either the state or federal government?
Mr. Chairman, through you, those regulations are governed by both either the federal government or New York State. They're not local decisions to be made. Mr. Chairman, I just forgot the first part of the question. I'm sorry.
I think that was the question. Is that correct?
The difference, if I may, Mr. Chair, the difference between, you said before that it was a state or federal, now you're saying there's some underlying mandate, and we're just trying to figure out what the difference is from what your earlier response to us was.
Mr. Chairman, through you, it is not a requirement of the grant that the case be closed. It is a mandate of the state laws and regulations governing temporary assistance. Difference being that this is a 100% wage subsidy, whereas a program like TEAP is a grant diversion program.
I'm sorry, Mr. Chair, if I may, through you, Mr. Chair. So if somebody has, on the basis of, let's say a family of 4 or 5, and this wage of $8 an hour doesn't meet the basic needs and those kinds of things, does that case remain open while those folks are still employed?
Mr. Chairman, through you, I believe I understand the question being asked, and the answer would be yes. A case could remain opened if this wage were not sufficient given the household size.
All right. Legislator Lightfoot.
I just want to make sure have clarity on this too. Is it not true, through you, Mr. Chairman, that the state mandates the actual ability for the TANF and the TEAP program? However, the administration of those programs is up to this body or to the county. Is that not true, through you, Mr. Chairman?
Mr. Chairman, if I understand the question correctly, the answer would be no. Local social services districts administer the program, but we have very little leeway. We are governed by the rules of the TANF program and the rules of New York State as published in 18 NYCRR. We have very limited flexibility in how we deliver these services.
So through you, Mr. Chairman, this county doesn't have the administrative power to determine when a case is open or closed in TANF or TEAP, through you, Mr. Chairman.
Mr. Chairman, the TANF program and the state safety net assistance program. Welfare programs in general are a means-tested program that come with very prescribed eligibility criteria that local social services districts are mandated to follow.
Thank you, Mr. Chairman.
You're welcome. Are there any other questions? Being no more discussion, all those in favor, please signify by saying aye. All opposed, item carries.
Referral 333,
Moved by
acceptance.
Legislator Jolovic, seconded by Legislator Quattro. Is there any discussion on this? Being no discussion, all in favor, please signify by saying aye. All opposed, item carries. Next item.
Referral 334, acceptance.
Moved by Legislator Quattro, seconded by Legislator Hannah. Is there any discussion? Legislator Andrews.
Thank you, Mr. Chairman. Through you to the administration, this referral and the next few make reference to how in previous years the county received a consolidated child and family health grant. And now, this year, as of April, the State Department of Health and County have broken up that consolidated grant into individual programs. Just for comparison purposes, could I receive a document that tells me the funding for previous years, for last year, under the Consolidated Child and Family Health Grant for each of these programs, and then the funding each of these programs will be receiving this year individually, since that grant is now broken up?
Through you, Mr. Chair, we'd be happy to do that.
Thank you.
Thank you.
Any other discussion? All those in favor, please signify by saying aye. All opposed? Next item.
Referral 335, acceptance
Moved by
of a grant.
Legislator Hannah, seconded by Legislator Jolovic. Any discussion? Legislator Cruz.
Thank you, Mr. Chair. Through you, I'm curious as to why the contract, these particular contracts are singled out and the names are provided for these individuals as compared to the other parts of the programs where it's being funded as projects.
Through you, Mr. Chair, the four names that are mentioned in the title are contractors that are providing services in the program, and generally we don't put the names of the contractors in the subject line of a referral. I think what probably happened was we had two referrals, one for the WIC grant and one for these four contracts, and they got put together when we realized that they had the same funding, and that's how those names ended up in the subject line.
So, through you, Mr. Chair, these individuals will be contracted individually with the county to do that particular work?
Through you, Mr. Chairman, yes, that's correct.
Thank you, Mr. Chair.
Any other discussion? Being none, all in favor, please signify by saying aye. All opposed? Item carries. Next item.
Referral 336,
Moved by
acceptance.
Legislator Jolovic, seconded by Legislator Quattro. Any discussion? Legislator Andrews.
Thank you, Mr. Chairman. In terms of the early intervention program, can you tell me how many children are currently receiving services under this program?
Through you, Mr. Chair, we serve approximately 1,400 children in Monroe County.
And through the chair, could you just speak to the trends of that number? Is that increasing or decreasing or staying static year to year?
Through you, Mr. Chair, that number has been increasing gradually since the beginning of the program 10 or 12 years ago, and it has been an issue that we have scrutinized very closely, trying to understand why that is occurring. We had anticipated that initially there would be some continuing growth in the program as it got established in the community, and then eventually it would level off. But it has just continued to grow by a few percentage points every year.
And through the chair, I mean, you may not know certainly definitively, but do you have a suspicion, or do you know why that's happening?
Through you, Mr. Chair, it seems to be a combination of factors. I think that we still people are learning about the program more. Last year, there was a significant effort by the state and by the American Academy of Pediatrics to do more intensive developmental screening for young children. And I think that we've continued to we've continued to find new ways to perform outreach related to the program.
And through the chair, how many service providers are there affiliated with the county for this program?
Through you, Mr. Chair, I believe that there are about 65 contracts that we have, but I'm not absolutely certain of that. But it's a large number of providers. Some of them are individual therapists, and some of them are big institutions like Mary Cariola or Cerebral Palsy, United Cerebral Palsy.
Okay. And lastly, through the chair, could I receive a copy of a list of all the providers?
Yes, I can do that.
Thank you very much.
Any other discussion? There being none, all those in favor, please signify by saying aye. All opposed, item carries. Are there any other matters to come before this committee? Legislator Lightfoot. Oh, I'm sorry. I thought your hand was up. Legislator Andrews.
Thank you, Mr. Chairman. I just have a couple of questions regarding child care, since I view it as an open topic in this committee, as we've discussed it so often. About a couple of weeks ago, I read just a very brief media report that guidelines had finally been issued from the federal government and state government regarding the stimulus money for child care, about $3 million. Through the chair, could you describe how the county is either using or anticipating to use its stimulus money for child care?
Mr. Chairman, it's a good news, bad news answer, to be quite honest with you. The federal government has released its guidelines to the states on the use of these stimulus funds for child care. The bad news portion of the answer is we are still awaiting guidance from New York State Office of Child and Family Services to local districts. There was a conference call today on that very issue, and no definitive timelines have been given for when that guidance will be issued. It is a little frustrating. It's a little concerning. Rumor is in the districts that the state will be pushing down a lot of the reporting requirements to local districts. We're not sure what that's going to look like. The other part that's going to be a challenge is tying the use of stimulus funds to jobs created or jobs saved. So we really are looking for some strict guidance on that.
Through the chair, can I request that once you receive that, that you provide an update to this committee in terms of how the county will be spending that money?
Mr. Chairman, through you, that's not a problem. Happy to do so.
And also through the chair, do you have an amount that you're expecting to receive for child care?
Mr. Chairman, through you, the preliminary and estimated allocation for Monroe County was approximately $2.98 million.
And for what period of time was that, through the chair?
Mr. Chairman, through you, the stimulus funds are for a 2-year period following the federal fiscal year beginning October 1st, 2008 and lasting, I believe, through December 31st, 2010. We being the local districts, may or may not receive a second allocation at some time in the future.
Okay. Thank you. And one other question regarding child care issue through the chair. Also, if I could just receive tonight just an explanation about the recent class action lawsuit, I guess. It's been filed against the county regarding the family percentage of copay.
Mr. Chairman, through you, actually, that is not a lawsuit filed against Monroe County. It is a lawsuit filed against the state of New York.
Okay, thank you very much.
There being no further business, the meeting of the October 27, 2009. Yes, sir.
Just a real quick question, because just something that just sort of came right. Are we going to take a position on that lawsuit in terms of the county and what we think should happen with regard to the percentage of copays?
Through the chair, that's not something at this time that I could comment on as far as what our position would be. I think it'd be most appropriate to review the legal papers before we would take a position as a county on that. And because we're not a party to the lawsuit, we have not been served with the papers that I'm aware of.
Would it be appropriate for you to at least keep us updated in terms of what the impact of that decision is going to be with the county, and if there is any room for us to make some kind of statement to, in terms of what our best interests are as well. I mean, obviously, we're going to be either victimized or or otherwise be impacted by whatever the decision is, and I'm sure that we must have some kind of way of relaying to them what our interests are.
Through the chair, if it becomes the situation where the county is able to participate in the lawsuit, we would certainly be glad to provide you an update on that.
Okay, thank you. And again, sorry, Mr. Chair.
No problem. Thank you. There being no further business, this meeting of the October 27, 2009 Human Services Committee stands adjourned. The next meeting of the Human Services Committee is scheduled for Tuesday, November 17, 2009 at 6 p.m.